Welcome, everyone, to Health Authority TV. I am Janan Sarwar, the Deputy Editor for Health Authority Books, an imprint and partnership between Indie Books International and Global Bookshelves International. I'm very excited to introduce you to someone special who I've had a chance to meet in person, Dr. Colette Sinclair. She has over 20 years of experience in the intersection of neuroscience, psychology, and research in consciousness. She is a clinician and an author and many more things. Let me allow her to introduce herself even more. Thank you so much for being here, Dr. Colette.
Thank you. Thanks for having me. So, I am a scientist. I study emotions and the impact of emotions on health and on our states of consciousness. And I've been practicing clinically for 21 years. So, I have had the opportunity to learn about people and our development on a lot of different dimensions for quite a long time. And I have written a book to make the science accessible to as many people as possible. All of the people that can't get into clinic or can't access that care, they can pick up my book, Emotional Posture: Six Energetic States to Create and Sustain Inner Alignment. And that's the culmination of my life's work so far.
That is incredible. So, if you had to define who you work with and who you serve as in your role as a clinician, who would that be? Who's your client?
So, my clients are the people that have done everything possible to dial in their health. So, they've addressed all of the physical issues as much as possible. They've had experience with therapy and coaching, and they're really, there's this persistent gap between who they know themselves to be and how they're actually functioning and feeling day to day. So that is the gap that I address through this energetic state training and through the overall framework that I apply clinically. I also really enjoy working with people that are drawn to integrative healthcare and consciousness, people that really are aware of the impact of consciousness and want to scaffold their consciousness, and leaders, people that are leading professionally and personally. And I just love the idea of helping leaders because they have such a huge impact on their teams and their environment. And I love this idea that I can indirectly help a lot of different people.
Absolutely. I mean, in your book, it's as well, you empower the reader to understand ways that we ourselves can achieve these higher states. And could you tell a little bit more about that and the services also that you provide to help all these people, the leaders to all these individuals that you just described?
Absolutely. So, in my business, Integrated Mental Wellness, I work with individuals clinically and I look at the health of the brain and the nervous system. So, I utilize this neuropsych component to really evaluate the whole person. And so within that business, there's a lot of different pieces: neuropsychological assessment, and as I said, the clinical and individual therapy. And in general, just the integrative consultation piece, which I find very fun. As I said, a lot of times people that find me, they've tried a lot of different things and they're not feeling good. So I'm able to use my whole person approach, which includes biochemical health, which includes brain and nervous system function, as well as, psychosocial, components, all of those components to really look at what are the missing pieces. So I do enjoy that work. Um, but the culmination of my professional work and research, really it is in my emotional posture framework and the coaching that I offer through integrated mental wellness. And that framework, it is a six-state framework that really allows me to train a person in these elevated emotional states, which create pretty significant biological shifts. So watching a person go through that transformative process over a 3 to 6 month period of time is enormously rewarding for me. And it's the thing that I enjoy doing the most at this point in time. I also do speaking engagements and I work with small leadership teams. But I would say the emotional posture framework and coaching model is the thing that I really enjoy the most right now.
Something you've been doing a great job, and I've been following along, is your advocacy about emotional posture. So if you had to just describe it to someone who know nothing about it, how would you describe that?
So, what I would say is that, emotions are central to our health,
Hmm.
and who we are as beings moving through this world. I personally say quite often that emotions and spirituality are synonymous. Our energetic health is synonymous with our spiritual health, because, uh, you know, our energy attracts to us and it also dispels in our life. And that's part of our unique navigation technology that we have here having this physical experience. So if I'm going to describe it, what I would say is that by training in these energetic states, we are able to influence multiple aspects of our life. We're able to create massive shifts relationally, physiologically, professionally, psychologically, and spiritually. So again, my belief and what my clinical research has shown me is that emotions are more central. And within our culture, we make them peripheral,
Yes.
and we have a tendency to fragment people. And what I'm saying is that this has to be a pretty significant piece of integrative health.
Absolutely. So you're kind of flipping it around and asking us to really understand our emotional states and how that impacts who we can become and how we can achieve so much more if we're in alignment. And you do speak a lot about alignment in your book as well.
Yeah. I do think that when we align, well, I know that when we align our thoughts and our emotions, and our physical bodies, that we can really create these massive shifts in our life. But the other piece here is that, you know, our emotions really dictate our overall health, whether that's physical health, whether that's mental health, and even the outcome. If we have had some kind of a diagnosis or a disease, um, the actual prognosis is totally tied in to our emotions. And there's a lot of research that demonstrates this. And I do not understand why this is not yet a piece of the healthcare model.
Yeah.
Um, when we know that people that are living in low level emotional states like shame and guilt and anger, we know that not only are they going to attract a disease because of how their physiology is influenced by these low level emotions, but also their prognosis is poor
Mm.
versus somebody who's living in gratitude or love. And they usually have a far better outcome when they do have a health issue. So knowing that, having the research to back that up, to me, it makes a lot of sense that our health models would begin to include those types of metrics. What is a person's chronic emotional state? And if it's not a positive one, if we focus on training a positive one in, we know they're going to have a better outcome in terms of overall health. And even with prevention, we know that they're less likely to have a health issue because of the way the emotions influence our cells, our overall physiology. So I just think it's a very big piece of the equation that's been left out. It makes sense to me that it's been left out because, doctors and clinicians, they like to work with what's seen.
Right.
It's, we want to measure everything. We want photographs of everything, and in the medical world, they're very comfortable with the physical body and, there's some efforts towards the mind, but there's not yet, effort around, the unseen part of the person, which is, the emotions and the way that the emotions are tied in with the will and the spirit. So
Absolutely.
I think that has to be a part of the overall healthcare model going forward. That's what I would love to see. I don't know if I'm going to see it in my
Yeah.
lifetime.
Yeah, it sounds like I mean, that is the big question that we ask everyone on this podcast is if you could wave a magic wand and redesign the healthcare system, what would it look like? So it sounds like, being able to, I guess it's not, you can't measure it in the same way that we're measuring blood pressure. But you've done research, which I think is fascinating, and in the cardiology world, as you were mentioning, how our cells and how the emotional state can impact our healthcare outcomes. If you had, in a nutshell, to explain what you really imagine this redesigning to look like, what would that be?
Well, I would say, emotional health is foundational.
Okay.
It's not peripheral, it's foundational. And if we start to see it in that way, then we can move towards a preventative model where we are noticing people that are in chronically low emotional states. We're addressing that at a young age. We're training in healthy emotional states at a young age. That's going to lead to far better health outcomes. It's going to influence this whole person approach that I'm talking about. And the last piece, which is also related to emotions, is that I think consciousness can be used as an overall health metrics as well. And so again, when we're looking at what is a person's overall awareness, what is their level of consciousness, and how that's influencing their current health and then their prognosis for a health issue. Um, I think this could really change healthcare as we know it, and it could change outcomes for a lot of people.
This is off the wall, random question, but I'm just curious, in your practice in, over 21 years, you've met so many different people, and along the time in this 21 years, our devices, our cell phones, all of this has been so much more integral to everyone's life. Have you noticed a change in the level of consciousness of people over time?
It's changing everything, and I'm actually so glad you brought it up. I don't have any problem with controversial topics.
Yeah.
And this is one piece that I do not know why people are not talking about this more, but the influence of technology on our overall health,
Yes.
electromagnetic frequency on our overall health, and on our brain function, our nervous system function. It's really interesting that you bring this up because I just wrote an article on energetic health. It's not out yet,
Okay.
but some of those actionable tips, it had to do with electronic hygiene
Yeah.
and how the electromagnetic frequency from all of our devices, and
Yeah.
I'm sitting here right now, I've got 3 devices around me, okay?
Same, same.
And
Yeah.
that's because that's a part of our life. Everything is
Mhm.
technology based. We don't even, use paper anymore. We don't even have hard copy books, you know? But all of that is interacting with the electromagnetic field that's surrounding our body. It's all informing that field. And if it is toxic, then it's having a toxic influence on our electromagnetic field. And we certainly now have the science to show the way that it's influencing brain function, and how it's deteriorating the function of the prefrontal cortex,
Yeah.
and all of those executive functions like attention and organization and planning and execution, all of those functions are reduced. So what that looks like in the population is it looks like more people have ADD and ADHD,
Right.
and more people have mood disorder. But we don't actually know because no one's taken out the time to tease out what is the influence of the technology in terms of increasing those numbers in that particular disorder. So I think that especially with young people and just people that are aware and people that are proactive with their health, I think creating those healthy habits around technology, I think that the most important thing that we can do is not sleep with any devices near us,
Mm.
because the only time that our body is rebuilding and
Mm.
restoring is when we're asleep. And so it's really important that that electromagnetic field around our body is it's protected because we're vulnerable. Right? We're completely vulnerable when we're sleeping. And so if we have a cell phone near our head or a laptop or an iPad that's not turned off, it's actually permeating our field and disrupting it and creating a situation where we can't fully heal. Our
Yeah.
cells, our DNA, all of that can't fully heal while we're sleeping. So, the number one thing that I like to recommend is keeping everything at least 6 feet away from you. The further, the better. I personally keep my phone in the bathroom away from me, as far away from me as I can. And I insist on that with my children. Um, but just, protecting
Yeah.
it's called a biofield while you
Yes.
sleep.
Yes.
The other thing that's very practical that I like to suggest is turning off all of the alerts that are unnecessary. So, for example, maybe the call from your husband can always come through, maybe the call from your kid's school can always come through, or anything that's really, really important. But I don't know about you, I notice we get pinged for everything.
Yeah.
Every little news update, every new follower, I mean, it's like we're constantly having our attention pulled and interfered with. And that's very disruptive to our thinking and again to our brain function and very specifically to our nervous system.
Right.
And I think that's why we're seeing this nervous system, revolution where everyone's interested in the health of the nervous system. There is definitely a correlation between devices coming on the scene, the iPhone in 2007, and the state of everyone's nervous system, because
Yeah.
we know that there's more social order now. There's less violence, there's less trauma. Let's just say in the States. Because when we do have something happen in the States, it's highly publicized, but there's in general, it's a very gross general statement, but there's less, and yet people, their systems are behaving like they all have PTSD.
Right.
You know,
Absolutely.
yeah,
Yeah.
and there's no acknowledgement of how devices are influencing our nervous system.
Absolutely.
You know, and in,
Yes. Yeah.
and instead what's happening is people are manufacturing trauma to justify their symptoms.
It's, oh my goodness. We can
I-
go, I
Yes.
mean, I absolutely am sure we could talk so in depth because you have such a phenomenal background in the fact that you understand the neuroscience of it all, the psychology behind it, and the research that you're doing to kind of pull all of this together and understand our states of consciousness and the ability to obtain that and how everything plays. I really recommend everyone to follow you. What is the best way you would like people to connect with you?
Okay, well, thank you for offering that. So people can follow me on Instagram under Dr. Colette Sinclair. You can find me on LinkedIn. You can find me on YouTube. You can find me at ColetteSinclair.com for anyone that's interested in the coaching or the clinical aspect of what I do. And certainly, you can find my book on Amazon or Barnes and Noble or many digital distributors.
Awesome. I can't wait to see what's next. Did you want to share anything about what is something big that you're working on in the next?
Yes, yes. I'm excited about a couple of things. The thing that I'm, working on currently is two new emotional posture books. One is Six Energetic States to Create and Sustain Feminine Power. And the other is Six Energetic States to Create and Sustain Wise Leadership. So these are different emotional postures. These are different universal energetic laws that support um, the leadership and women being fully embodied in their power. So I think those are important topics. They're topics I'm interested in, and they're topics that I want to share with others in terms of my unique perspective. And the second piece that I'm really excited about is generalizing my research and my work to youth and studying how youth are able to learn and use these emotional postures, kids ages 5 to 18. So I'm really excited about that study and seeing what results are yielded as a result of that.
I will follow along. This was amazing. Thank you for all the tidbits of information you shared. Everyone, I hope you follow Dr. Colette, and thank you for being on the show. And for everyone else, may you continue to be healthy, wealthy, and wise. Have a great day, everyone. Thank you. Bye.